Mental health. What comes across your mind when we listen to this term? And I'm 100% sure that when we think about this term, it's not inferior or it's not foreign to us. We all know the importance and significance that mental health has in our life. And mental health is like the overall development in emotional, social and spiritual significance. And if we are not being able to express ourselves freely across our peers, our family members or to oneself, then it's of no use. And the prerogatives has always been the reluctant ones in the whole society. The mental health as a word comes across when we come across and we hear. The thing that strikes our mind is depression or anxiety issues or any kind of mental illness. But the ironical and hypocritical thing is about the fact is that the relevance and the significance that it should get, it does not get that much of relevance in today's society. People are of the perception that people who are suffering from mental illness or depression or anxiety are means of mockery or frustration or fun, thrill, enjoyment by mocking them and trashing them up, due to which people are reluctant in sending about their worries, tensions, and feelings, emotions, and turmoils that are going through and keep them intact within themselves, leading to a lot of stress, anxiety, and a lot of family and disturbed relationships and disturbances. What's the importance of mental health? Mental health is something which requires unbiased communication, unstipulated, terminated, introspection, reciprocated communication, and non-judgmental attitude. It's just like a normal ailment, like cancer, but it has been considered as a stigma or a taboo from the societal's perspective. It has to be changed. There has to be a change. Things has to change. The world needs to come to an understanding that it's okay if you're not feeling okay. It's okay if you are not feeling good about yourself. You just have to express yourself, your heart out to your near ones, your dear ones, or to a specialist. And times have changed, and mindsets needs to be changed. Awareness is the most important thing about it. And there is times of disparities, of changes. And mental health is very, very important. If you are not emotionally sound, if you are not emotionally healthy, then you cannot be considered physically healthy as well.
Hi. To speak of mental health depends on two things. Firstly, parasthiti, and number two is the manasthiti that we have. More often than not, our mental health largely depends upon the kind of manasthiti that we are having in a particular period. And our manasthiti depends largely on the parasthiti that we are surviving in. Mental health has taken a toll over the millennials in the recent times. If we had a glimpse of the number of suicide cases in India, we will be scared by how we are proceeding ahead. The teenage, the youth, the adult, no one is left without mental stress, and this has taken a toll over the kind of life we are living. Speaking of mental health, I would like to quote a few lines of one of my poems. कुछ खुद से ही फिर जाया करती हूँ, कुछ खुद से ही फिर जाया करती हूँ, खुद को खुद ही से नाराज पाती हूँ, खुद को खुद ही से इस तरह अलग रखती हूँ कि मैं खुद ये न जान पाऊँ कि मैं खुद मैं कब होती हूँ, खुद खुदा खुद महबूब बन जाती हूँ बस, और फिर क्या एक समा नया बना फिर जी उठती हूँ, सांसों से ध्वनि बुन बैठती हूँ, इसी तरह खुद को खुद ही में समेट जाती हूँ. We know a person is suffering mentally when he or she keeps himself or herself confined. The person that always reaches the office late, the child that doesn't want to wake up early in the morning, that teenage who doesn't want to socialize, all are depressed. The farmer, the rape victim, all. And this needs to be changed. This needs to be handled with care.
There is no single cause for mental health disorder. Instead, they can be caused by a mixture of psychological, social, and environmental factors. People who have a family history of mental health disorders may be more prone to developing one at some point. Changes in brain chemistry from substance abuse or changes in diet can also lead to mental health disorder. Psychological factors and environmental factors such as upbringing and social exposure can form the foundation of harmful thought patterns that can lead to mental health disorders. Also, life experiences such as stress or a history of abuse, especially if they happen in childhood, can also lead to mental health disorder. Also, a traumatic brain injury, a mother's exposure to virus or toxic chemicals while pregnant, the use of alcohol or recreational drugs, having a serious medical condition like cancer, and also if a person feels alone or isolated for a long time duration, it can also lead to a mental health disorder.
Hello ma'am, here I am going to talk about 10 consequences of depression, and those are feeling of sadness or emptiness, trouble with memory or decisions, risks of heart attack, weight fluctuations, weakened immune system, insomnia, preoccupation with death, feeling of gloominess, and constricted blood vessels, increased pain sensitivity, lower interest in sex.
Now we know about depression, its causes and consequences. But the most important thing is how to get rid of depression or how to fight against depression. So no need to worry. According to research, there are some basic preventive measures to fight against depression. These are: exercise regularly. It increases our body temperature, which can have calming effect on the central nervous system, which helps to fight against depression. Build strong relationship. Strong support system or social support can protect against depression. Reduce stress. Avoid overcommitting to things and learn to let things go that you can't control. Stay away from toxic people. Stay away from people who makes you feel worse, and cut people out of your life who takes advantages of you. Eat well. Eat balanced meal with lean protein and lots of fruits and vegetables. Get plenty of sleep. It is necessary, and to get proper sleep we need to meditate before going to bed and not look at any screens for 2 hours before bedtime.
Hello everyone. Now I am going to start with the topic of HIV/AIDS as a communicable disease. HIV/AIDS is a communicable disease which stands for Human Immunodeficiency Disease. HIV/AIDS is a disease which has been effective since 1980s. From the late 1980s, we can see the rapid increase of HIV-affected people in India and across the world. HIV is a virus that targets immune system, increasing risk of other infections on human body. As visible in the diagram, HIV/AIDS has the following symptoms: high blood pressure, high heart rate, vomiting, mood swings, diarrhea, etc. Now, going to the causes and consequences of HIV/AIDS. While the causes of HIV/AIDS can be of following types: vaginal intercourse, sharing of common needles among friends or any other person. HIV/AIDS can also cause from a mother to her child through breastfeeding. HIV/AIDS also has the following consequence in today's scenario. Most of the HIV positive children had died under the age of 5. HIV has tremendously affected the health sector of India and also the world. Though in today's world HIV is accepted as a disease, but also in today's world some society doesn't accept this as a disease. People who are getting affected
from this HIV disease, they face a very dangerous consequence, and their basic right to live with respect and dignity in the society is being violated as a consequence of HIV/AIDS.
Now let's talk about the prevalence of HIV in India in recent years. According to a report of National AIDS Control Organization of India, Maharashtra was estimated to have highest number of HIV infection in 2019. Total 8.5 thousand new cases, followed by Bihar 8,000 and Uttar Pradesh 6.7 thousand new cases. The major factors to the growth of these epidemics were high rate of urbanization and migration to the state, mainly to Mumbai from all over the country, a well-established sex industry, high prevalence of sexually transmitted diseases, and national highway passing through the states. In Maharashtra, 96% of HIV infection occurs through sexual transmission due to flourishing migratory commercial sex trade, and 2.5 lakhs of commercial sex workers operated in Maharashtra. Mostly they comes from rural area to earn money. Assam is categorized as a low HIV prevalence state with an estimated adult HIV prevalence of 0.07% only. However, the prevalence rate has increased from 0.04% in 2007 to 0.07 in 2011.
Looking on prevention of HIV or human immunodeficiency viruses, anyone can get HIV, but we can take a step to protect ourselves and others from HIV. The first point is, get tested for HIV. Talk to your partners about HIV testing and get tested before you have sex. Use these testing locators from the Centers for Disease Controls and Prevention to find an HIV testing location near you. The second point is, choose less risky sexual behaviors. HIV is mainly spread by having anal or vaginal sex without a condom or without taking medicines to prevent or treat HIV. The third point is, use condom every time you have sex. To achieve the maximum protective effect, condom must be used both consistently and correctly. Do use a condom every time you have sex. Do put on a condom before having sex. Do read the packets and check the expiration date. Do make sure there are no tears or defects. Do use water-based or silicone-based lubricant to prevent breakage. The fourth point is, limit your numbers of sexual partners. The more partners you have, the more likely you are to have a partner with poorly controlled HIV or to have a partners with a sexually transmitted diseases. The fifth point is, get tested and treated for STD. Insist that your partners get tested and treated too. Having an STD can increase your risk of getting HIV or spreading it to others. The sixth point is, talk to your healthcare provider about pre-exposures prophylaxis. PrP is an HIV prevention option for people who do not have HIV but who are at risk of getting HIV. PrP involves taking a specific HIV medicine every day to reduce the risk of getting HIV through sex or injection drugs use. The seventh point is, don't inject drugs. But if you do, use only sterilely drugs injection equipment and water and never share your equipment with others.
The biggest challenge when it comes to living with HIV/AIDS is the stigma that surrounds it. We don't even talk about it. The government of our country has provided us with some policies, and the Constitution of India gives us the right to non-discrimination. This applies to people with HIV/AIDS also. Let us look at some of these specific rights and some of the government policies.
The ART program, ART centers are established where eligible persons with HIV/AIDS requiring ART are identified through laboratory services like HIV testing, CD4 count, and other required investigations, and provide free ARV drugs to eligible persons with HIV/AIDS continuously by counseling before and during treatment for ensuring drug adherence. At present, 6 ART centers, including 2 ART plus centers and 1 FIART center, and 11 ART centers are functioning in the state of Assam. To measure the CD4 count of the ART registered patient, 4 CD4 testing centers have been established so that ART center can be initiated to the ART registered patient on accurate time. At present, 4 CD4 testing centers are functioning in the 4 medical colleges of Assam. Under the service of care and supportive services, care and support are provided to the person infected and affected with HIV/AIDS. At present, 4 care and supportive services are functioning in the state of Assam. Drugs of opportunistic infection are provided and distributed free of cost to the HIV patient through the ART centers and ring ART centers of the state. The law of our country prohibits people from discriminating on the basis of HIV/AIDS. As per the law, no person shall discriminate against the protected person on any ground such as the denial or continuation of or unfair treatment with regard to access to or provision or enjoyment or use of any goods, accommodation, service, facility, benefit, privilege or opportunity dedicated to the use of the general public or customarily available to the public, whether or not for a fee, including shops, public restaurants, hotels and places of public entertainment, all the use of wells, tanks, bathing ghats, roads, burial grounds or funeral ceremonies and places of public resort. Moreover, the state also as no HIV test or medical treatment or research can be permitted to be conducted over any individual without their informed consent over the matter, and also no person is at all obligated to disclose the fact that they suffer from HIV in order to obtain employment or any service unless done with the informed consent of the individual, or if a court order is required such a person to do so. The registration also safeguards the property right of HIV positive individuals and provides that every HIV affected person below the age of 18 years shall have all the normal requisite rights of residing within a shared household and thus enjoy the facilities of the said household without being outset or discriminated against. The law further prohibits all individuals from publishing any information or advocating any untoward feeling of hatred against HIV positive individuals along with any person who is living with such persons. The penalty for any violation of the Act through the means of publication of information about people living with HIV or advocating hatred against them shall attract imprisonment ranging from 3 months to 2 years or a maximum of Rs 1 lakh fine or both.
It's high time that we stop talking. Let's not keep this disease behind closed doors. Let's speak up, let's create awareness. Let's understand that there are some groups that are more vulnerable to this disease than others. Let's not discriminate people living with HIV/AIDS, and let's get involved in safe practices to prevent this disease from spreading. It's when we collectively come together that we will be able to fight with this disease.
Now we know about the causes and the consequences of the cancer, but do we know about the preventive measures for it? According to research, there is no certain way to prevent this disease, but doctors have identified certain ways to reduce the risk of cancer. Those are: stop smoking. Smoking is linked to several types of cancer. Stopping now will reduce your risk of cancer in the future. Avoid excessive sun exposure. Harmful ultraviolet rays from the sun can increase your risk of skin cancer. Eat a healthy diet. Choose a diet rich in fruits and vegetables. Select whole grains and lean proteins. Exercise most days of the week. Regular exercise is linked to the lower risk of cancer. Maintain a healthy weight. Being overweight or obese may increase your risk of cancer. drink alcohol in moderation. If you choose to drink alcohol, limit yourself to 1 drink a day. Ask your doctor about immunization. Certain viruses increase your risk of cancer. Immunization may help to prevent the viruses.
The government has implemented schemes for the welfare of the patients suffering from cancer, and those are:
India is one of the few developing countries that has formulated a national cancer control program. The program envisages control of tobacco-related cancers, early diagnosis and treatment of uterine cervical cancer, and distribution of therapy services, pain relief, and palliative care through augmentation of health infrastructure. Cancer registries are recognized as vital components of National Cancer Control Program (NCCP) of our country in planning, monitoring, and evaluation of cancer control activities. This began with a population-based cancer registries (PBCRs) at Bangalore, Chennai, Mumbai, and hospitals HBCRs at Chandigarh, Dibrugarh, and Thiruvananthapuram. NCDIR provides a quick overview of the pattern and magnitude of the problem in a particular defined geographical area. In fact, the Cancer at Last project was the first to provide important leads about higher incidence of cancer in the northeastern parts of our country. National Cancer Control Program is a centrally-sponsored scheme by the Ministry of Health and Family Welfare, Government of India, which was initiated in the year 1975 with priorities given for equipping the premier cancer hospitals or institutions. Later, the program was modified in the year 1984 to 1985 with emphasis on primary prevention and early detection of cancer. The District Cancer Control Program was introduced during 1990 to 1991 and later modified in 2000 to 2001.
So here we get to know about what is cancer and how it's caused and what are its preventive measures and how the government is working on it. Let us see the ground reality, then how the people are getting affected by diseases and how many have lost their life for these diseases. Cancer is the second leading cause of the death.
According to World Health Organization, cancer is responsible for 10 million deaths per year. Globally, about 1 in 6 deaths is due to cancer. Approximately 70% of death from cancer occurs in low and middle income countries. According to World Health Organization, 3 lakh new cases of cancer diagnosed each year among the age group of 0 to 90. 30 to 50% of cancer could be prevented. The economic scenario of cancer is very significant and increasing. The total economic cost of cancer in 2010 was estimated as $1.16 trillion globally. The cancer has emerged a serious health concern in India. India is likely to have over 17.3 lakh new cases of cancer, over 8.8 lakh deaths due to the disease by 2020. At the top, the breast, lungs and cervix cancers are found in India. The data also reveal that only 12.5% of patients come for treatment in the early stage of disease. ICMR stated that cancer associated with the use of tobacco account of about 30% of all cancer in males and females. Among males, there is a significant increase in the case of the cancer of colon, rectum and prostate in the cities like Bangalore, Chennai and Delhi. While among the women, there is a significant increase in the rate of cancer related to breast, uterus, ovary and lungs. As per data, for every 2 women newly diagnosed with the breast cancer, 1 woman die of it in India. As many as 2,500 persons die every day due to tobacco-related disease in India. There were 9 lakh deaths in 2010 approximately because of smoke. Number of people living with this disease in India is around 2.5 million. Every year, over 7 lakh new cancer patients are registered. The burden of cancer is expected to further increase due to changing lifestyles and demographic transitions and other risk factors.
but the survival rates are improving for many types of cancers. We can thank to the improvement in cancer screening and cancer treatment.
Coronavirus is an infectious disease caused by severe acute respiratory syndrome coronavirus 2, in short SARS-CoV-2. The disease was first identified in December 2019 in Wuhan, in China. There was an epidemiological association with a seafood market in Wuhan, where there was also a sale of wild animals. First case was reported to WHO on 31st of December 2019 of unknown pneumonia, with the Wuhan Municipal Health Commission saying that they were monitoring the situation closely. The COVID-19 virus spread primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Most people infected in the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. India reported the first confirmed case of coronavirus infection on 30th January 2020 in the state of Kerala. The affected had a travel history from Wuhan in China.
A hearty namaskar to everyone present here. Let's know about the day-to-day symptoms of COVID-19.
So, if you are not feeling well, please immediately consult a medical practitioner to have an accurate diagnosis and proper treatment of COVID-19. The typical daily symptoms are continued from the study of 138 patients at Jomnam Hospital of Wang University and another study involving 135 patients from Jingtan Hospital and 56 patients from Wang Pulmonary Hospital. These symptoms are broken down into day 1 to day 2. The beginning symptoms are similar to the common cold, with a mild sore throat and neither having a fever nor feeling tired. So, day 3, the patient's throat starts to feel a bit painful. Body temperature reached at around 36.5 degrees Celsius. Although it's uncommon, other symptoms like vomiting or mild diarrhea are possible to set in. In day 4, throat became painful, more serious. Other symptoms like feeling weak and joint pain start to manifest. The patients may show a temperature ranging between 36.5 degrees Celsius to 37 degrees Celsius. In day 5 to day 6, mild fever starts. The patients show a temperature reaching about 37.2 degrees Celsius. The second most common symptoms, dry cough, also appear. And breathing difficulty may occur occasionally. Most patients in this stage are easily feeling tired. Other symptoms remain about the same. These 4 symptoms are among the top 5 key indicators of COVID-19, according to the final report of the initial outbreak conducted by the joint missions of China and WHO. In day 7, the patients that have not started recovering by day 7 get more serious cough and breathing difficulty. Fever can get high up to 38 degrees Celsius. Patient may develop further headache and body pain or worsening diarrhea if there are many patients are admitted to the hospital at this age. Day 8 to 9. On the 8th day, the symptoms are likely to be worsened and the patients who has coexisting medical conditions. Shortness of breath comes from frequent temperature reaching goes well above 38 degrees Celsius. In one of studies, day 9 is the average time when it starts to affect 40% of the patients. Day 8,
10 to 11. Doctors are ordering imagining testings like chest X-ray, capture respiratory distress in patients. Patients are having loss of appetite and many may face abdominal pain. The conditions also needs immediate treatment in ICU. In day 11 to 14, for the survivor, the symptoms get better and breathing difficulties may start to increase on day 13. But some patients may still be affected by mind cough even after hospital discharge. Day 15 to 16. In day 15, it is opposite conditions for the rest of the minority patients. The fragile group must prepare for the possibility of acute cardiac injury or kidney injury. In day 17 to 19, COVID-19 fatality cases happen at around day 18. Before the time, vulnerable patients may develop a secondary infection caused by a new pathogen in the lower respiratory tract. The served conditions may lead to blood coagulations and ischemia. Day 20 to 22, the surviving patients are recovered completely from the disease and are discharged from the hospital.
Hello everyone. So as we all know about the causes and consequences of COVID-19, do you know about the preventive measures for it? So as per the guidelines of WHO, World Health Organization, they given us such preventive measures for COVID-19.
Clean your hands often, use soap and water or an alcohol-based hand rub. Maintain a safe distance from anyone who is coughing or sneezing. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze.
Wear a mask when physical distancing is not possible. Avoid touching your eyes, nose and mouth.
If you have a fever, cough and difficulty breathing, seek medical attention.
In a time of chaos amidst COVID-19, the role of government was a major concern for India.
The government has initially responded to the COVID-19 pandemic in the country with thermal screenings of passengers arriving from different countries. As the pandemic progressed throughout the world, the Indian government began issuing recommendations regarding social distancing measures and also initiated travel and entry restrictions. By early to mid-March, the government had drawn up plans to deal with worsening of the pandemic in the country by setting up additional quarantine centers and treatment facilities across the country. Different ministries were informed to ensure the availability of resources. Indian government stopped issuing of all new visas, and the people who were returning from COVID-19 affected countries were asked to be quarantined for 14 days and also announced compulsory screening of all international passengers arriving in India. Multiple states across the country began shutting down schools, colleges, public facilities such as malls, gyms, cinema halls, and other public places. Throughout March, several shutdowns were initiated, and the Indian government ordered a widespread lockdown and also announced a 150 billion aid for the health care sector for developing testing facilities, PPEs, ICUs, ventilators, and for tracing medical workers. During that time, they had also launched a smartphone application called Arogya Setu to help in contact tracing and containing the spread of COVID-19 pandemic in the nation. And during that time, the government had also announced
an economic package of 20 trillion for Atmanirbhar Bharat, self-reliant India, and the economic package is nearly 10% of the GDP.
Warm wishes to all in all present here. So here we are going to see the impact of Corona in our country in a data wise. How many people were affected, how many cases were found positive, and so on. So India recorded 216,919 total confirmed cases, 6075 deaths, and 104,107 cured cases. And this update is released by the Union Ministry for Health and Family Welfare. But if we see at the larger context, this was not the only outcome of Corona in our country. Like impact wise, if we see the number of people who were left unattended in the roads, the wage workers who had to walk for miles to reach their family, the number of wage laborers who lost their lives on the way is also a significant impact of that. The loss of occupation on the part of people, the loss of economy on the part of the country were also major impacts of Corona, which we in our country. So here's hoping that in the near future, if our country ever faces any such pandemic or any such other crisis, we only hope that the government wouldn't showcase the same sheer ignorance towards its people, the same people who cast vote for them, the same people for whom they vowed to work for. So that was also another significant impact we saw in our country, India. So here I would like to wrap up, and my fellow mates would take it on from here.